Have some water. So we are waiting for other members to join. We do have attendees, which is wonderful. But we're not going to start without a quorum. Oh, good. Putting on my sweater, I'm cold.
Hey, Jessica.
You could.
I'm here, but I may drop because I'm going to be in transit.
Okay. That's
All
good.
right.
And I'm here. You will hear some background noise. I'm still at a baseball game that is going over. But I don't think we have a quorum yet, do we?
No, we don't.
But we do have Dottie and Mariana in the in the waiting room so that we know when to promote them.
Yeah. And I'm promoting Amanda.
Yeah, I try to watch to see if more committee members.
So technically now we do have a quorum. We're happy to wait. I don't know if we want to wait, but.
Do we know if we're waiting on specific folks or?
Cherie Lackey, Councilmember Burns, Councilmember Reed.
And we're anticipating them, correct?
Correct.
Okay, so we'll just give everybody a few more minutes, and hopefully we'll be able to start. And if not, I guess we'll just be hopeful.
Yeah.
So Jessica, I'm sorry, we do have a quorum now. I think I saw Amanda joined. So
We do have a quorum.
Maybe we could just do things like.
I didn't realize we had a
rules
quorum.
of-
I'm so sorry. I apologize. I misunderstood. So then we can call the meeting to order, and we can. We'll go through. Have you already taken attendance, Jessica, or do you need us to?
We can sort of do that by voting on
By
the suspension of the rules.
Perfect.
Yes.
I need a motion to suspend the rules.
motion to suspend the rules.
Thank you, Derek. And I need a second.
I'll second.
Thank you, Archana. Jessica, can you take the roll, please?
Yes. Okay. Chair Oldsfry.
Yes, I apologize. I couldn't get off mute. Yes, I vote to suspend the rules.
Thanks. Kathy Hayes.
Yes.
Thank you. Amanda Ngola.
Aye.
Thank you. Vice Chair Ohanian
Yes.
and Archana Sood.
Yes.
Thank you.
Wonderful. So we've suspended the rules. The next thing we need to do is to adopt the minutes from the last meeting. I need a motion.
Motion to approve the minutes from the last meeting.
Thank you, Derek. And I need a second.
A second.
Thank you, Amanda. Jessica, can you call the roll?
Yes. Excuse me, Chair Oldsfry.
Yes, I wasn't there, but I can vote for the minutes or.
Yes, if you had the chance to look them over and you didn't notice any.
I did look them over. Yes.
Great. Thank you.
I vote yes.
Vice Chair Ohanian,
Yes.
Kathy Hayes,
Yes.
thank you. Amanda Ngola,
Yes.
thank you. And Archana Sood,
Yes.
thank you. Perfect.
I apologize. My Zoom app is having quite a bit of trouble today. And the next item we have on the agenda, have we had anybody else join us yet, Jessica?
No, we haven't, but we do have attendees for public comment if we wanted to.
Yes, that would be great.
Okay, so attendees, if you wouldn't mind virtually raising your hand. Okay, perfect. I'm gonna promote Stephanie Mendoza.
Oh, hello, can you hear me?
Hi, Stephanie. Yes, we can. Yes.
Oh, hi. My name is Stephanie Mendoza. I'm a second ward resident. I am tuning in, myself and a few other women, Rocio Mancera, Sonia Rosales, and Rebecca Mendoza, Robles, sorry, to support the $500,000 to a welcome center. And we feel like this service is highly needed in our community. As we speak right now, you know, we have been organizing just as, you know, residents of our community to get aid to a lot of the refugees that came from Texas. And, you know, it'd be great that if we had a place here in Evanston that can do all this service, you know, and that are knowledgeable, people that are not knowledgeable and understand how to help people. Instead of, you know, us as community members having to, you know, find people housing. We've had one family that was living in a car, another family that was looking for a place to stay that we were able to find housing for. So far, 4 families placed in housing, and a welcome center here in Evanston would, you know, be able to, you know, provide good services for people in a way that is equitable and understands the needs of our refugee and immigrant community. That's all. Thank you.
Thank you so much. Do we have, and thank you so much for taking your time to share and advocate. Do we have other members from the public who would like to make comments?
Hello, yes. My name's Rebecca Mendoza, and I'd like to make a comment as well.
Yes, absolutely. Please do.
My name is Rebecca. Again, I am the president of Evanston Latinos, an organization that was founded in May of 2020 in response to the COVID-19 pandemic. And I want to speak in support of the Welcome Center because over the last 2 years, we've been the primary organization here in the city of Evanston helping this population, immigrants, mixed status households, Spanish speakers, and undocumented residents. And as a volunteer organization, we don't have the capacity to meet the needs of all of those different groups that I just mentioned. And so based on how busy we've been over the last 2 years and everything that we've done, we know that this population could be better served by having the adequate welcome center like other communities have. And if anything, honestly, I feel like the amount should be increased given what's going on in Texas and given climate change, right? Anybody who has been, who follows public health or trends around the world know that we as a world are going to begin to see more migration due to climate change. And so it would be great for the city of Evanston to have some foresight in prepare for these populations that are going to be coming and be able to respond adequately to these human services. So that's That's my comment. I have two other women that would like to comment, so I'm going to pass the phone over to Rocio Mancera.
Hola,
Thank you.
buenas. Perdón. Soy Aire.
She can go, right?
Yes, please.
Ok, bueno, hola, mi nombre es Rocío Mancera. My name is Rocío Mancera. I'm more comfortable and speak Spanish, okay? Maybe traduction, my friend Rebecca. Bueno, para mí es muy importante que haya un centro de bienvenida, y yo lo pruebo absoluto. Estuvimos durante una pandemia muy dura hace 2 años, y yo creo que es hora de que pues, la ciudad nos reintegre un poquito de lo que estamos necesitando, que es un cuarto de bienvenida, y yo lo apoyo absolutamente. Eso sería muy confortable para las familias latinas viviendo aquí en Evanston, ya que han pasado por cosas muy difíciles en estos 2 años. Y sería muy agradable y muy importante para nuestra comunidad. Estamos hablando casi por todo. Hay muchísimas personas que están muy interesados, no encuentran un lugar que se identifiquen como un centro de bienvenida, ¿verdad? Entonces, para mí es muy importante que de verdad tomen en cuenta que lo puedan hacer y que nuestras familias hispanohablantes se sientan, y no nomás hispanohablantes, sino todas las que son latinas, se sientan bienvenidas. Gracias. Les voy a pasar a Sonia.
Okay, so next we have Sonia Robles.
Hola, buenas noches. Soy Sonia Robles. Yo también estoy abogando por un lugar para que todos nosotros estemos unidos como comunidad. El centro de bienvenida sería muy bueno para nosotros, para todos los que vivimos aquí en la comunidad, para apoyar más a la gente y posiblemente a otros inmigrantes que lleguen a venir. Para mí es muy importante que haya más actividades para nuestros hijos, para los jóvenes, y el centro sería muy buena opción. Gracias.
That's all the public commenters from our group. Thank you.
Thank you so much. Thank you for taking the time for helping the community and advocating for something so important and that you care so deeply about. Do we have other comments from the public, Jessica? From other groups, perhaps.
Sorry, hang on. I don't believe so. Stephanie, I'm going to try to drop you back down to a participant. If I accidentally delete you, please come back.
Thank you. And I have to head over to another meeting, but thank you so much. Bye.
Thank you. Bye-bye.
Okay, anyone else for public comment? If you could please raise your hand virtually, I will allow you to. Okay, perfect. We do.
Wonderful. And you are promoting them. And once they are in as panelists, they can introduce themselves and we'll give them time.
I'm sorry, I'm not promoting. I'm just giving permission to speak because I don't have a way to drop someone down without blocking them from the meeting. I apologize. So, so Mr. Hernandez, I believe you are able to hear us.
Yes, I can hear you. Can you hear me?
Yes, thank you.
Great. So again, wanted to introduce myself. I'm Sergio Hernandez. I am the board president at School Board District 65, Evanston Skokie. Just wanted to come in to support your agenda item E, which is the approval of the $500,000 of Arpa funds for the Welcoming City, and these funds going to family focus. Again, I'm the son of 2 immigrants. Again, first generation Mexican American, Chicano, and again we didn't have welcoming services and welcoming centers at my time, and my families had to navigate through figuring out how to live in the society with 5 boys, and we were able to somehow make it. And how beautiful would it be, right, to have a welcoming center here in Evanston to ensure that we continue to diversify our community. and also create an economic impact with the work ethic that many immigrant and refugee families bring to our communities. So again, just I'm here to support that, and I'm actually here to support increasing the ARPA funding for it, and if it's possible for the Social Service Committee to recommend another 500,000 to make it an even million, to make sure that again we have the highest quality welcoming center for our immigrant and refugee folks from around the world. Again, and this would also be a really good again a continuation of our policy as a city of being a welcoming city, right? And you all know right now the impact that's happening around the country with the chaos that's being sown by Republican governors who are again trying to make political statements and utilizing human lives and lives of families and children to make a political statement and by dehumanizing them and dehumanizing our communities. So again, it'd be a great resource to have to counter some of these ploys that continue to exploit and dehumanize folks and families who are in dire need of help and who are fleeing countries and that have violence or are again victims of policies, international policies that are pushing them to come to our country. So again, just wanted to again give my support to the Social Service Committee supporting ARPA funding for the Welcoming Center and the funds going toward family folks, and if possible, increasing the amount. Thank you.
Thank you so much for your service and for taking time to advocate today. We appreciate it. Jessica, do we have additional public comments?
If there are any other public comments, please raise your hand.
Right. Well, thank you, members of the public, for coming forward and speaking on these important items. We will move to our next.
Is one public comment from Councilmember Reed. I believe he would like.
I think we're just
No, that
admitting
wasn't
him.
That was just me using the opportunity to acknowledge
Get
that
into
I'm
the
here and
meeting.
Yes, thank you.
I was trying to say it. We have to promote Councilmember Reed, and I was on mute. Sorry about that.
No worries, and welcome, Councilmember Reed. Thank you. We will move to our new business, and that is the first item is the discussion and vote to approve ARPA funding for a welcoming center for up to $500,000. I will need a motion to open discussion.
I'll move discussion.
Thank you, Councilmember Reed. I also need a second. Is that correct? Or just a motion?
Motion and a second.
That's what I thought. Thank you. I just need a second from a member of the committee.
Second, open discussion.
Thank you, Eric. And with that, we can begin discussion.
Would it be okay if I shared my screen, Jess?
Sure. I was going to say, do you want me to share? And that way you can speak and all. Okay, great.
And if we could promote Mariana Osoria and Dottie Johnson.
Okay, yep, hold on, let me do that first. Okay, is everybody able to see my screen?
Yes.
Perfect.
So good evening, everyone. My name's Ana Elizarraga, and I am the Housing and Economic Development Analyst for the city. And I'm here to talk to you a little bit about the Welcoming Center, just give a brief overview of what we talked about in our last meeting. So the Welcoming Center is a program funded partially by the state of Illinois that aims to give a one-stop shop for new immigrant families and individuals coming into the country and potentially to the city of Evanston, to give them a range of services and resources so they could better familiarize themselves with the different systems. For example, how government works, or how different school systems work, since they are different in their countries of origin. And this just gives them a way to become a little bit more civically engaged and potentially become leaders in our community. So Family Focus is requesting an up to amount of $500,000. And this proposed budget would cover up the pilot year for the Welcoming Center from July 2022 to July of 2023. And then it's broken down as follows. So for the project planning, design, and community engagement, it would be $21,460, $60,000 in startup costs, and $540,000 in program operations. And for projected services, they are aiming to provide 400 unduplicated individuals services in a full year of program. Next slide, please. So as I said, the Welcoming Center aims to be a one-stop shop center to provide linguistically and culturally responsive case management for immigrants and other refugee individuals and their families. They have a co-location model which collaborates with other partner organizations in the community to provide services where the participants naturally convene, such as schools or faith-based entities. They also provide community education workshops on topics of importance to immigrants and refugees about resources that can make it a successful integration into the community. And they also have regular meetings with local service providers to enhance service effectiveness, and then also to avoid duplication of services with other organizations. So you were all sent the rubric, and we got your votes. If we could go to the next slide. So the Arpa rubric is divided into feasibility, capacity, budget, return on investment, inequity, addressing inequities and inequality, and also community support. So for feasibility, out of 35 points, Family Focus got 29 points. And the average score for them was 4.1. For capacity, 34 out of 35, and with the average score of 4.9. For budget, it got 24 with an average score of 3.4. And for return on investment, it was 29 points out of 35 with an average score of 4.1. For addressing inequities and inequality, they got 32 points out of 35 with an average score of 4.6. And for community support, they got 31 points out of 35 with an average score of 4.4. So of the total 210 points, they got 179, and their total average score was 4.26. And below, you see the comments, and those were the comments that were submitted along with the rubric scores. So I will go ahead and read them. The first one says, Family Focus's history and consistency for over 40 years are phenomenal in supporting families regardless of barriers. I have complete faith that the Welcoming Center will be a continuation of the family and community support work that they are known for. The second comment reads, additional details and specifics on metrics from the other 3 welcoming centers would be appreciated. The third comment, the per individual amount seems reasonable. However, additional details would have been helpful. And the last comment reads, additional details on services provided and how those services assist individuals would have been helpful. So I just want to remind everyone that we do have Mariana Osoria and Dottie Johnson from Family Focus here tonight to answer any questions. And should the Social Services Committee want to change their score after hearing their responses, they may do so by emailing housing@cityofelvanston.org, or they can email Jessica or myself directly if you'd like to change or modify your scores after Mariana and Dottie have a chance to respond. And I think Sarah, are you raising your hand?
I am, and I just wanted to mention that there was additional, the rubric went out after the first meeting and the information in that packet and that discussion. And the packet tonight actually included more detail. So that was one of the reasons we wanted to make sure the committee had the opportunity, if they chose, to modify their scores with the additional information provided in tonight's discussion.
Okay, so I will give a chance now for Mariana or Dottie if you'd like to add anything. Do I see them?
Can folks hear me?
Yes.
Great. So I see that you can't really see me, so I don't know if that's something that you can change, but if not, that's okay. As long as folks can hear me, I think that's good.
I can promote you to panelist. You just have to accept when you get the.
Great. Well, good to see everyone. Good evening. I am very looking forward to answering any questions that any of the committee members might have, but appreciate again entertaining this opportunity. I think we intended to indicate in the proposal itself some of the deliverables that we were able to meet in our programs and in our other 3 programs that we serve in the city of Chicago, in Aurora, and in Cicero, Illinois. But I'm happy to answer more specific questions that you all might have in terms of the number of participants that we serve, the type of services that we offered, the number of referrals that we have made in the past, our percentages of goals that we've met. We can talk a little bit about that if folks have questions. And although it may not have all been listed in the proposal itself when we did our PowerPoint presentation, we did talk quite a bit about some of the program services that are offered, and it seemed like that might have been an area where folks wanted a little bit more information. So we had talked about doing things, the things that we do are things like interpretation and translation, court advocacy, emergency cash assistance, brief counseling, employment readiness, referral services, immigration support services, and in some instances, immigration legal services. We can talk about how that might, what that might look like in Evanston and how we've implemented it at some of our other centers. All 3 of our centers are DOJ recognized, Department of Justice recognized, which means that as long as we have the staff that is accredited, Department of Justice accredited, we're able to do some legal services, legal processes out of those offices. Our hope is that once we build the Evanston Welcoming Center, we would add that as another location. Once we're able to really build that center up and roll out program.
We do employment readiness services. We have a notary. Again, that's useful when you're doing translation work, computer literacy, adult education, mental health. Those are just some examples. We had talked also about doing a co-creation process that would help to build the services that we would be offering at the Evanston site, because we truly want to engage the community and hear what services they're most interested in, so that as we're building the program, we identify what some of the top priorities are, et cetera, and are able to, respond to what those community needs are more immediately. So those are some example, again, housing support, and, just an example, we've actually pivoted some of our family-focused Chicago staff to support Evanston families just these past couple weeks, because there have been a few that from the migrants from Texas that have come into Evanston, and we have then just wanted to respond to be able to support those families. Even though we don't have a current welcoming center there, we have pivoted our staff at other centers to be able to support them and to respond to the immediate needs of those families that include housing, emergency assistance, things like clothes. We met a family that, when we met them, all they had was the clothes they were wearing. So being able to respond quickly and support their needs as quickly as possible. So those are some of the program activities that that we would do if we were awarded a welcoming center. And I'm just going back to the rubric really quick, so I make sure to so in terms of metrics, one of the things that we count a few things. One of them is the raw number of individuals that are served. So as you heard, we will, in a full year of service, we will serve 400 individuals in case management services. Those are folks that we would provide in-depth case management and assessment, an individual family plan, and then ongoing support to ensure that those goals that the family identified are met. In addition to that, we also will measure the number of families that are identified as being crisis intervention type of families. So those families that have those cases or those issues resolved. So for example, a family who might be in crisis that needs housing, we will not only count that individual as coming into the center, but also, was that crisis resolved? Do they have housing at the end of the time that we're working with them? We also, as a welcoming center, because as you can imagine, there are different levels of needs. So we also measure the number of people that just call or come into the center that identify or have a request for something specific, are not necessarily at that moment interested or able to engage in full case management services, but need an application for, or need some interpretation for an application that they might have, or want to know where their child should be registered in school. Those are traditionally, if we don't work with them with intention, because they're not able at that time, or there is, they really only have a specific need, we will document those individuals, as well as the number of referrals and information services that we offer. We measure the number of workshops. We have a specific number of, at least through our state funded entities, there is a minimum requirement in terms of the number of families who attend workshops, the number of outreach activities that we do, and then the community service coordination, which is basically the community alliance that Anna referenced, to ensure that, we are not duplicating services, to identify where those gaps in services are, and also support other nonprofits to be better able to work with immigrants and refugees. An example is, in Cicero several years ago, we did an immigration 101, so to speak, with our community partners, so that they had an understanding of, the different terms and language that might be used within the immigrant and refugee community, and then some basic know your rights information, so that not only is there a welcoming center, but that our partners and other places where our families might be interfacing also have understanding of what what our families might be facing and the issues that are presented. And that has traditionally gone very, very well with our participants, and we've had our partners, I should say, and we have had very good attendance around that. And if there are any other specific questions around metrics or specific programming at some of our other centers, I'm happy to answer any of those questions that you might have.
Thank you so much for your time and that information. I want to ask any, Sarah points out that in the packet, page 39, you can see the deliverables and measures. I want to ask if committee members have additional questions. Amanda. Oh,
sorry, I had to find my hand. It sounds like the services are fantastic. The deliverables, I love that there's a model with other welcome centers. I was just curious, and this might be out of the scope of our decision, but I'm curious, after, this 500,000 and the startup costs, I'm just curious, what's the idea around continued funding for the welcome center?
That's an excellent question. I think it's a critically important question because we know that these funds are limited. So we've been talking with our elected officials, both local and statewide, around welcoming center services and expanding welcoming center services. The state of Illinois increased the Illinois Welcoming Center services line by $20 million this past session. The intention is to increase welcoming centers around the state of Illinois. And so we have already spoken with some of our elected officials so that we can advocate for Evanston being in that funding pool when the opportunity arises. In addition to that, we spoke directly with the Department of Human Services, Office of Welcoming Centers, and shared with them the data around Evanston and why we think it's important for Evanston to have a welcoming center, and talked about the opportunity that was there in kind of building it up and then being able to apply to the state of Illinois when they put out their notice of funding opportunity, so that we can actually get funded by the state of Illinois to be able to sustain the program beyond that. So we will continue to do that. We've gotten a lot of positive feedback from that, a lot of interest. In fact, just recently with these more recent arrivals, all welcoming centers have been asked to pivot their work, but Family Focus has been one of the lead organizations that has really been responding. And so I've made sure to talk about the connection to Evanston with some of these more recent immigrants, and with those elected officials and with those that are managing the Welcoming Center services programs at the state level. So we feel good that there will be an opportunity to apply, and that having program and actual metrics to be able to talk about that we've done will support a NOFO application once one comes out.
Thank you.
You're welcome.
Thank you. Great question, Amanda, and very thorough answer. Amanda, do you have any other questions?
I don't, but thank you.
Oh, perfect. And do other committee members have questions?
Yes, Chair, I do have a quick one for Mariana. So hi, Mariana. Thank you so much for taking the time to present and answer our questions and follow up with us here. I just wanted to understand the timeline of funds that we're being asked to approve, because I think it was earlier on in the presentation tonight, July was the starting time frame, and we are already almost in October. So are you anticipating a shift in the time frame for these approvals? Because I'm looking at the proposed budget toward the end of the packet, and it talks about starting in July, going through June for the first year pilot, and then continuing on the second year.
Thank you very much. I think that may be it may be a typo. Dottie, you can talk about that a little bit. I think one of the things that we did want to include in the budget is some of the work that is going to happen before we get the funds. And that includes being able to convene some community sessions. We knew that we would not at this moment have approval, but we've been working on planning some co-creation sessions and expect that we'll want to do those before we actually open the actual welcoming center, which we hope we will be able to do in January. But Dottie, if you're on, can you talk a little bit about that July through June timeframe there?
Sure. Thank you, Mariana. And I apologize for not being on camera, but I'm in the car, so I don't want to. You won't see much, but my white face blew me out of the darkness. So anyway, the budget, the first half of the year, we had pre-planning, project planning, community engagement, work activities. The bulk of that work was going to start in the second quarter of the year. So the majority of that work will be happening in October through December. We thought we would be starting a little bit sooner with this, but we have started some of the engagement on project planning and talking about possible partnerships. But the bulk of then the total planning cost is $21,000 of that budget. So I don't see us changing that timeline much, that we should be still be able to be ready to open early 2023 and be able to get rolling with the project and the services.
Okay, that makes sense. And now I'm looking at what was supposed to be spent starting in July, and it is, like you said, Dottie, some of the engagement and planning and design costs.
Right.
And I see in October, yeah, you ramp up with startup costs. Okay, got it. Thank you very much for that clarification.
Mm-hmm. Thank you for that great question and great clarification. Derek, did you have any other questions?
I did not, Chair. Thank you.
Thank you. Other committee members?
Yes, sorry, I thought I raised my hand. Thank you, Chair. And I just want to say thank you to the presenters, to Mariana and to Dottie and the whole team. I'm greatly supportive of this. Actually, I'm wondering if Mariana, if I can have your email address, I certainly want to connect with you regarding the work that you all are already doing with partners relating to the migrants who are being sent here from Texas and Florida and other places. I think this ties into some work that the city already has and coming down the pike pretty soon. And so if you're able to drop your email in the chat, or if I can get it from maybe Sarah or the city's team, I'd love to connect offline.
Absolutely. I will throw it in the chat. Doing that right now, but I would love to have more conversation with you about this and what's happening at the local and at the state level.
Thank you.
Thank you so much, Councilmember Reed. Do we have other comments from committee members?
Hi, this is Kathy Hayes. I just have one question. Thank you, Mariana, for all of the work that all of you do over there at Family Focus. Are we anticipating any refugees from Ukraine or any of the other European centers of crisis at this time, as well as the African continent?
So it's a really good question, and it's one of those questions that you can't always fully answer because we don't know what's going to happen next, right? We know that at the state level, the state is preparing and has been supporting Ukrainian refugees, Afghan refugees, and other refugees from other countries. And so we don't know the number of folks that'll be coming in, but there is not only through the Welcoming Center office, but that office also, not only does it fund Illinois Welcoming Centers, it also funds a number of other immigrant serving organizations, including those organizations that do resettlement. And so we expect that there will be, there has been already quite a few Afghan refugees, and then also Ukrainian refugees that have been coming in into the country. One of the things that we've been learning more recently is the amount, where an immigrant lands and then the number of moves that they have impacts their ability to navigate and settle. Does that make sense, right? Obviously, it's kind of like not rocket science. You know that if you move lots and lots of places, it gets more challenging. So that's one of the things that we're trying to do with this new influx of immigrants from South America, because they're being moved to so many different places. So, the answer is that yes, there is some plans at the state level. We don't know where they'll be going in the state, but we know that there is funding to support immigrant and refugees, in particular from Ukraine and from Afghanistan. There is not as coordinated an effort from other places, such as the continents of Africa or from South America, Central America, and Mexico.
Okay, thank you. Given the disruption in Haiti, I didn't know if there was going to be some more issues. Thank you.
Yeah.
Thank you so much, Kathy. Thank you so much for answering. Do we have other questions from the committee? All right, I had one question, if you don't mind. Can you dive into a little bit? And I think the answer may be it will depend on community feedback, but you've listed out quite a few services that you'll be providing or potentially providing based off of community feedback. Can you talk a little bit perhaps about how that works in either your current center, how you envision that working in your center in Evanston? Because obviously 400 folks that you're serving and intensive case management, the budget wouldn't fit, that you're not providing all of those services to all of those individuals. Can you sort of explain what you anticipate beyond your case management? What are your next sort of largest services that you offer? What are the ones where you just, it's only needed by a few members? Can you sort of explain that breakdown?
Mm-hmm. Yeah. So I can talk a little bit about what some of the top services requested have been at some of our other centers. And so the services, I would say the top 5 services are things like public benefit access. So understanding public benefits, whether there's eligibility, being able to complete applications, all of that will entail things like translation and documents, discovery and things like that. So that's one of the major supports that we offer. What we found at these centers is that many times families who live, they either are in mixed status homes, multi-generational. There is someone in that home who might benefit, for example, for Medicaid. And nobody knew that, right? Because they just, that's not something they thought they were eligible for. They never asked. And so our case managers will actually walk them through that whole, the assessment, and then identify who's in the home, right? What do they have access to, and be able to support them. So that's one of the things. The other piece that we've done a lot around is early childhood development. We have many of our families are very young families. So they have children, or mom is pregnant, and we're able to immediately connect them to our, the heart of what I say is family focuses work, which is early childhood. So they're able to get that. Legal services, that includes immigration services, but other legal services like landlord-tenant issues is another, legal piece. Domestic violence situations are sometimes times when we need legal services for our families. Housing, health, and then mental health services. So those are probably the top 5 things that we see at all 3 of our centers, right? Some of those other things, as you mentioned, they will depend on what the family needs are, what the family dynamic is, who lives in the home. all of that, and which is why it's really important to have that critical case manager that's building that relationship with the family. And sometimes we don't always learn what they need in that first assessment because we're just getting to know them, they're just getting to know us, and that ongoing case management is what helps to build a relationship where we then will learn and identify additional service needs that the family might have. In terms of like educational pieces, there's quite a bit that is common as well at all of our centers. Understanding and navigating the United States educational system is critical. Understanding and navigating when a family member, child might need special needs in their school. Understanding government in general. Civic engagement is something that we like to talk with individuals around so that they have an understanding of what is happening here. Not financial literacy, but understanding the financial systems in the United States. So things supporting people who might be unbanked to be banked, explaining and understanding the difference between a currency exchange and an actual bank or credit union and things like that. So those are some of the general education things. And then of course, know your rights. Understanding your rights and legal services is another area of education that is common among all of our centers. And those key themes are some of the things that we offer. Did that answer your question?
Absolutely did. Thank you so much, Mariana. And sort of a follow-up, did you find, I especially think, in Illinois, we've covered children on Medicaid, regardless of documentation status, to really one of many great things about our state. And then as obviously in recent years, we've expanded Medicaid eligibility down to 42. Did you see in the previous administration around public charge sort of needing to do sort of more education on on Medicaid and hesitancy? And have you seen that sort of rebound by chance, or is there still that?
It's a great question, and I appreciate your knowledge and understanding around that. Absolutely, family focus and many organizations, regardless, I think, of our Illinois Welcoming Center services, were challenged by prior administrations and the rhetoric and conversation and changing of potential public charge changes. So we actually, not only family focused, but other organizations did lose participants because they were afraid to engage in simple things like home visiting services. And so we did have to do a lot of education around that, a lot of talking with families. Sometimes, we were able to maintain them enrolled. Other times we had to respect their decision and they disenrolled in programs. And so we have, public charge continues to be a concern. And it actually has always been a little bit of a concern. Anyone who has some immigration status that is other than citizenship, when they hear public charge, they are concerned about that. And it's not easily understood, and not everyone understands who it applies to. That has always been true. But with the recent, with the rhetoric that was happening, and then the intention and changes that were made to public charge, that was exacerbated. And so we continue to do conversations, communication about public charge. In fact, even as providers, we are always working with our immigration attorneys to help explain things, like even in this case with these recent immigrants that are coming, the dollars that we are using to support them, how is that going to be impacted? So it's an ongoing question that we get. I will say that there has been much improvement, at least on participants' end, but it still continues to be a challenge. And it's the work of, when I talked about like working with our partners about understanding immigration services and know your rights and things like that, that's really part of why we do that, because it's always a question, like, is this going to impact public charge? Who is impacted by public charge? Not everyone is, right? And so yes, it has improved, but it's something that we know we'll continue to have to address.
Thank you. I'm glad it has improved. And I think it's important to note that even though the administration has changed in the rhetoric, has changed, that it is still very top of mind, and we need to be really purposeful in our education and in empowering our neighbors and our community members to make sure that they are using the social safety net that they are eligible for and entitled to, and that they're not using it simply because of a fear,
right,
based off of mostly rhetoric. So thank you so much for that. I'll pause before we move on. Any other questions from the committee? Okay, with that, we've already motioned to open discussion.
Great, Chair Altsfrei, Kathy Hayes has her hand up.
Just a quick question. Is there anything in this proposal that I'm asking a wish list question actually. Is there anything in this proposal that has not been covered? Is there anything that you would like to have seen that has not been covered in this proposal?
Do you mean in terms of what we would have liked to add into this proposal?
Absolutely.
Okay, yeah, I mean, I think, we've, in recent weeks, I would say the past 3 or 4 weeks, because of the number of migrants that have been coming in and because of what we saw during COVID, I think one of the areas where we could benefit of is potentially having additional funding to provide emergency services. So things like, providing rental assistance, providing utility assistance, providing emergency type of funding for, like, maybe there's a medical issue that someone needs a medication, things like that. Those are some things that we do account for at some level, but because of the increased need that we've seen the past 2 years, and now with these recent migrants, that would be a value add, right? To be able to have access to additional funds to provide emergency service support.
Thank you.
You're welcome. Thank you for asking.
Great question.
The other quick thing I wanted to share, because we've been talking a little bit about kind of the advocacy element, is as an organization, not through this particular funding, but as an organization, Family Focus has become much more intentional in looking at what the barriers and challenges are for our community on the ground level that could help us to think about what advocacy and policy might need to be shifted and changed. And so we also, not only through our welcoming centers, but through all of our centers and all of our locations, are working with our participants to help to support them in helping us to know what the challenges are so that we can think about policies that might need to be different. So for example, Samantha, you talked about the health access, right, policy for 42 and older, right? That's some, we did some work around that because we saw on the ground what was happening. Another example is the access to emergency funding or charity care at hospitals. We get a lot of families who come to us that's come with a bill, right? That's that they went to the hospital for an emergency bay, they have a bill, they don't understand it, and to be able to help them access charity care. And there's been so many challenges around that we've seen firsthand, or that our participants tell us. So then we're able to talk with those departments and our partners to think about what policy should be changed, what advocacy needs to be done to support our community members. And so we do that we're doing that in all of our programs, but I wanted to share that because you brought up a couple times some policy changes and things that have happened. But again, that's, the community alliance piece that is part of the program really helps us to not only talk with our participants, but our partners. What are they seeing, right? Because we may not see every immigrant that lives in Evanston or in the area. Our partners will see some that we don't see. And so being able to share that knowledge base and really work in collaboration is part of the model that I think is really successful.
Absolutely. Thank you so much for adding that. And I will say, healthcare bills are confusing to me, so I can only imagine. So I'm so glad you're able to provide those services and advocate for those community members. Jessica, can you help me and let me make sure before we motion any other questions or comments? I didn't see Kathy's hand last time, so I want to just make sure I'm not missing anybody. All right, I'm going to take silence to mean that I think we are ready to close the discussion and move to voting to approve the ARPA funding of up to $500,000 for the proposal as it exists. I do need that motion.
I will move approval.
Thank you so much. And I'll need a second. Thank you. Jessica, can you call the roll, please?
Yes, thank you. Chair Olds-Fry.
I vote aye.
Thank you. Vice Chair
Support. Okay, great.
Sorry. Vice Chair Ohanian.
Aye.
Thank you. Kathy Hayes.
Aye.
Great. Archana Sood.
Aye.
Thank you. Amanda Ngola.
Aye.
Perfect. And I believe that's everyone. Thank you so much.
And then myself.
Councilmember Reed. I'm
Yes,
so
aye.
sorry.
No, you're fine.
Thank you.
Aye.
Thank you. Okay, so we pass unanimously. Thank you.
Congratulations.
Thank you. Thank you very, very much. We appreciate it and look forward to being able to come back and talk about what we've done, hopefully.
Wonderful. Thank you so much and congratulations. And I believe we have another vote and another discussion. And I need a motion to open debate on the childcare funding. And I apologize, I'm having technical difficulties with frozen screens all over the place, so I apologize.
Motion to open the debate for childcare.
Yes, thank you, Kathy, and I need a second.
A second.
Thank you, Amanda.
Thanks so much. May I share my screen? Okay, can everyone? Sorry.
Yep, we see it.
Oh. Okay. So yes, I'd like to briefly go over the results of our childcare worker premium pay program. Applications closed September 15th, the 17th, I believe. So we received 26 applications, 18 from center-based providers and 8 from home-based providers. The number for our home-based providers was small. We had about 22 centers and 22 home-based providers. Staff did call, email, and try to follow up with home-based providers. So, you know, I'm not sure what happened there. I think there were a lot of full voicemail boxes, and unfortunately, you know, we weren't able to reach some people. But we did learn that 7 of those providers serve 80% or more low moderate income families, 6 serve 50 to 70, 3 serve 40 to 25, and 10 serve less than 15% LMI families. We also found that 390 individual staff members were identified through these applications. 40 257 were full-time registered in gateways, and that means that people worked 35 or more hours. 78 were listed as part-time registered in gateways, meaning they worked 15 to 34 hours. And then this was something that we didn't anticipate when we opened the application, but there were 31 staff identified as working less than 50 hours or who may not have been registered in gateways. And I will talk about job codes next. But for this reason, and because the childcare providers, the whole industry we know is pretty historically underpaid, and all childcare providers working in front-facing positions with children and families or working on site were exposed to the same level of COVID risk because they were working with an unvaccinated population. So for these reasons, staff recommends, rather than basing an award structure on the number of LMI families served, that the committee instead consider basing awards on the number of hours worked in these three categories of full-time, part-time, and less than 15 hours. Can I also say, if you add these numbers, you will notice a discrepancy between the number of staff identified in applications and the number listed as full-time, part-time, and less than 15 hours. This discrepancy, staff is working with agencies to understand these discrepancies. Some staff members weren't listed in gateways, and these are primarily like office staff, finance staff, and the other set of staff not listed in gateways included like maintenance staff and food service staff. Yep, so I just wanted to put that out there for the committee. Of the gateways registered staff, there were up to 26 job codes. And this is important to really show the wide range of staff working with children and families. So of course, teachers and assistant teachers were the most common job codes identified, but and other common job codes included directors, substitute teachers or floaters who were working during COVID, and assistant directors. And then we had a number of job codes that were only identified once or very few times. And these job codes included things like youth development practitioners or education curriculum coordinators, home visitors, child care assistants, and family engagement support. So again, there's a range between job codes that we would assume would work more directly with families and some that maybe don't have as much direct interaction with families.
Just a note on that as well, we found that a lot of people, I mean, this happens especially in smaller centers, had multiple jobs because we got a huge range of, there are really quite a large number of directors and people with that level who actually spend quite a bit of time as classroom subs and things, especially during COVID, because there were so many people coming and going. So there was a great deal of fluidity, I would say, sometimes among the categories that makes it really hard for us to make neat and clean categories that we didn't realize quite how complex it would be, I guess is the best way to put it. Is that fair, Jessica?
Yes, and thank you for saying that, because I also wanted to call the committee's attention to job codes that were listed as other direct versus other indirect. And there were, to Sarah's point, people could identify as directors or director teachers. And I am not sure if the people who are registered in gateways have the ability to choose their own designation, or if the director of the agency identifies a designation, but I would request from the committee the opportunity to continue working with agencies to really understand who's registered, what their job codes mean, and to better understand some of the numbers and this valley between the 390 identified and the smaller number of full-time, part-time, and those working less than 15 hours a week, and people who maybe who were registered in gateways. So with that in mind, another staff consideration is that the committee consider in their award structure staff who work at least 35% or more in direct contact with children or families or on site. Because again, the time spent working with children and families leads to COVID exposure and risk, as opposed to staff who could maybe work from home. Okay, and finally, staff recommends a salary cap, and here are some guidelines for the committee to review. The final rule does give a salary cap of $90,510, which includes annual income and any premium pay. So if someone was right on the cusp and were to receive a bonus pay that would put them over that amount of 90,510, that person would not be eligible. Some other salary considerations. Whenever your Housing and Grants team is looking for guidance, we turn toward the census. And so Evanston's, according to the 2016-2020 census, Evanston's median household income is $82,335. We also looked at the HUD's definition of housing cost burdened, and there's a definition in the memo, but I would be happy to go into more detail. In a nutshell, a household is considered housing cost burdened if that household spends more than 30% of the gross monthly income on rent or mortgage, not including utilities. So the reason the amount of $57,320 is highlighted is because Evanston's median, again, according to the census, Evanston's median gross rent is $1,433. And so a household paying that rent would have to make at least $57,320 annually in order to avoid that label of housing cost burdened. So, okay, I see that there are some raised hands. Let me jump out.
Hey, Jessica, this is Derek. I think Chair Oldfred had to log off, but she logged back on now as IMHP, and she's an attendee. I think she needs to be promoted.
Thank you, Derek. I couldn't change my name while I was an attendee.
Sorry about that. Okay. Do you mind? I just have one or two more slides around this. Do you mind if I go right back to it? Okay, thank you. Okay. So to recap, staff recommendations around the award structure would be that the committee approve an up to award amounts based on the number of hours childcare providers work. And again, it could be the three categories or as the committee sees fit of full-time workers, part-time workers, and considering those who work less than 15 hours a week. Staff recommends awards to childcare providers who spend at least 35% of their time in direct contact with children and families or on site. And staff recommends awards to childcare providers who have an annual income at or below $60,000 a year. We did include a chart in the packet that sort of looks at what housing, the level of housing cost a household could pay and not be considered cost burden. And again, these numbers come from the 2016-2020 census. So we know, given COVID, housing costs have increased. And we did want to take that into consideration. So let me stop sharing now. And please, let's discuss. I also have a pretty simple spreadsheet. If committee members did want to look at changing award amounts, we could use that spreadsheet to kind of see how those numbers played out. If I should, first of all, would it be helpful? Would that be a helpful tool?
Yes.
I think that'd be helpful, yeah.
Jessica, I think also, do you have any of those levels, the kind of award levels that you'd calculated that are in the memo that we could maybe sort of point out? In our original proposal, we were estimating how many people might be eligible and all that stuff, and we had estimated a $1,200 award for full-time and $600 for part-time. We didn't have the under 15, but we did put an, as you know, we did add that in. Jessica did add that in our levels, but then played around with award levels, different award levels at each for each of those categories to give you some sort of, for instances of what might be considered based on your opinions of how this would, or your how you would like to see this work. And in the chart that was in the packet, the first two, from what we're seeing, if those awards were made exactly as is, to the best attempt we have with not having quite all the people reconciled, we would be slightly under the $500,000 for the one, and for the 1,600 award for full-time, 600 for part-time, and 350 for the 15 hours or less. And then award number 3 and 4 levels would look like they would exceed but the total budget, but would not, based on our recommendation of any of the other measures, like people working in person or on site, 35% at minimum, and also the cap of $60,000, because those were things that were discussed by the committee. So we wanted to try to give you a sort of a window on how those might work.
Yes, so that is the spreadsheet that I wanted to share. If I could get help, Sarah, from you or Anna, just once I share my screen, I can't see anybody. So if people have questions, please let me know or jump in. Okay. Can everybody see the committee recommendations?
Can see the committee recommendations, and I just, as we were working through this, I want to remind us the total, the goal, the target was approximately 500,000. Is that correct?
That is correct, and that's why staff is requesting an up to amount from the committee. So committee members will notice that the full-time staff exceeds the number of full-time people registered in gateways, as does the part-time and the less than 15 hours. So this is without having verification of, let's see, all staff. This does include the 390 staff members identified by the applications. Some people identified in Gateway's reports were listed as expired. And so I don't know, I still am working with agencies to understand if those people are expired and no longer staff, or some agencies list members that I don't have Gateway's registration information for, but if they're listed as staff, I wanted to include them in the hopes that, you know, as I'm working with agencies, we can find the documentation we need to prove staff eligibility. So these numbers could shift a little bit, and I believe that might bring us under budget. But if they didn't, staff could tweak the award amounts slightly to bring them a little bit lower so that everyone would get approximately the committee's recommendations.
Kathy Hayes has a question.
So let me, I'm sorry, I'm a little fuzzy from the last time we talked about this. I apologize for my blatant response. So in the packet where you had the different options, should I say, that also, that were different, the 4 different levels of options, that included all 390, with anticipating hearing more information or working more with at-home individuals, daycares, childcare services, workers. Is that my understanding?
So thank you for asking. At this time, I would hope to hear from other childcare workers. You know, the application is closed, and I did try to do a lot of outreach. If the committee should want to fund it a lower amount to kind of keep a reserve in case centers or home-based providers realize kind of after the fact that we're giving out these awards, we could see what that looks like. But no, right now, so right now, this model includes funding everyone the applications identified. Should the committee choose to set an income cap or the cap around the amount of time spent in direct contact with families, that would impact the staff numbers, and would also change, obviously, the award amounts, the award totals, if left at this level.
And this is a one-time process only. It is not, if we go into another pandemic, we will have to revisit this and adjust for the future. This is all retroactive, is, I guess, the appropriate way to ask the question.
Yes. And we set the budget first. City Council approved our $500,000 budget for this project. So if we did go into another pandemic, or if there was a risk of going over budget, we couldn't go over budget. We would need council approval.
Okay.
Which is why in the packet, there is a slightly more conservative award amount of, and I can put it up here on the screen, of $1,600 for full-time, $600 for part-time, and $350 for staff working less than 15 hours a week. And so if everyone was awarded, that does bring us under, everyone who's identified, excuse me, that does bring us under budget.
Sarah has a question.
Not really a question. I just wanted to comment that Jessica did a really thorough job of trying to reach all the childcare providers. And I think it's almost impossible to get everyone to apply. But I think that we actually got more engagement from the home-based centers or home-based providers than we've had. We haven't ever really done much outreach to that group. And Jessica found emails, she found phone numbers, and really, so I don't think we're going to get, and it wasn't just all at one time, it was throughout the period of this was open. So I don't necessarily think we're going to get a whole lot of stragglers or last minute applicants. I do think, just I remember from scanning some of the information we had, there are already even very few, frankly, very few people who would be screened out just on income alone based on the Arpa limits, which the committee voiced as being rather more generous than they thought was appropriate, which was why we put the $60,000 cap on. And we might have done it lower if we hadn't had the inflation we've had in the last year. That has really been, I mean, I think people are struggling at levels of higher income than in the past, even because of that. The rate of inflation has been quite remarkable after we had almost none for however many years.
Derek has a question or comment.
Thank you, Anna. So I'm looking, I kind of recreated your table, Jessica, in just an Excel instance on my laptop here. And to me, it seemed, well, first, I guess, question, up to the 500,000, if we leave any of that, if we're under 500,000, what happens to those dollars?
So that's a good question. I think that would go back into our pool of ARPA funding, correct, Sarah?
It would. I mean, that would be that. It was always an up to amount, and that's why we're trying to get as close to that amount as we can. Mm-hmm. So, which is why Jessica is saying, if we can have a little bit of flexibility, and the committee could even say, like, I'll give you an example. Yes, we really believe that the full-time people who are working should get no less than $1,650. I'm just using a number. And perhaps if there is an issue where if we're a little bit over, look to reduce one of the other levels slightly to just kind of make the math work. And as Jessica pointed out, we're still trying to get to the final number of people. And it's unlikely that it will go up, of course, with the applications closed. So we may have some fall off just because of who they still have to, as we reconcile the people and the numbers. One of the other challenges is, and I hate to say that, we have to be very thorough in this, because the providers will be actually releasing the money to their employees through their processes, because that will make sure that this is something that gets counted as taxable income, and we have to make sure that it's released that way. And then they have to provide us documentation to show that people were paid for the amount of money that we released to them. So that's what makes it really complicated. There was a great deal of saying ARPA was going to be more lenient in many ways, and it is lenient in some ways, but it's not lenient in us having documentation of exactly how the money was used. And that is one of the biggest challenges with these federal grant programs. You pretty much have to account for every penny.
So if I may, plugged in some of these numbers just using Excel, and I think if we take it that we have $2,400 per person to award. Sorry, 24. Never mind. Just forget that. So what I'm thinking is, we full-timers get about 1,500, 1,550. And then part-timers 800, and then under 15, 400. So it kind of halves as you go down the amount of hours worked. I think that gets you right at that, basically $500 over.
That's cool.
But I think
you're right.
But I think at least you get at least people who are, because I mean, at least what I saw, Jessica, in the packet, part-timers can work 15 hours to 34 hours. So if someone's working 34 hours, that feels like at least that they should at least be getting half of what a full-timer gets at minimum. And then same thing with somebody who's working 14, 15 hours. I think seems like it's,
I agree. Yeah.
Fair.
Agreed. And it sounds like, Jessica or Sarah, that we would have at least a couple folks probably fall off, so that $500 would be quickly assumed by simply them not being eligible due to income. Is that right?
Correct. Yeah.
Was there discussion the last time, and this was months ago, again, I apologize, about if they had already received some type of incentive or emergency money?
I don't think so, but I mean, I do think, I don't recall that discussion, Kathy, but I do think there's a possibility that they might have. I mean, these individuals might have children. They might have received the child tax credit. They might have received, various other funding streams based off of their eligibility in other categories. But I don't know that we would necessarily know that. Would we, Sarah?
We did talk about one thing that they could have received, and that was the state had a bonus program, but that was released in 2021, I believe. And so we discussed that probably, especially given that really, I would say by far the majority of people that we were looking at had salaries under $40,000, and a significant number much lower than that, because as the childcare industry was saying, this is it's an industry that is not high paying at all, even for the directors or assistant directors, who, as we also found out, a remarkable number actually work in classrooms and things much more than we would have necessarily been aware of without that kind of information from them. So
thank you, Sarah, for that reminder as well. Kathy, was that helpful?
Yes, but I'm sorry. Yes, but yes, it did clear it up for me. I've been in several different meetings, so I might have mixed up some of the facts. However, I remember, Sarah, you saying that Arpa was changing some of their categorizing. Do we have a thread of that with this particular proposal?
Nope, this one is actually one that has stayed solid through the whole thing. And in many cases, when they changed them, they moved them around in the way how they categorized them, which was really weird. I mean, affordable housing, for example, well, it wasn't weird. It was affordable housing originally was focused largely on your spending was to be done in qualified census tracts, which are identified by HUD as being high need for affordable housing, that sort of thing, and very relatively low income. And then they realized that this actually really wasn't giving organizations the opportunity to address the needs of people, or in other areas that we may have an opportunity to put affordable housing and provide it for lower income people to move into areas of opportunity and things like that. And also had to do with forms of financing. They also did make certain other categories that were originally supposed to be focused on impacted and disparately impacted people that they had a definition for, and that was what justified them. And some of those things they finally just said, no, anybody who gets help, and mental health services was one of those. That became a category that was eligible. Basically, anybody was eligible, rather than the much stricter making sure you had a certain percentage on lower income or the disparately impacted communities as they defined them.
Well, I would like to say that I do appreciate the new numbers. I think that that Derek offered, that I think that it's provides a little bit more equity, I guess, or balance. I don't know which part to use, but I do understand these numbers, and I really do appreciate the change, the shift in them.
Thank you, Kathy. I agree. Other comments from the committee? Or questions? Do I have a motion to approve the awards at the levels that are on the screen? I can read them as we go, but and the at the levels of $1,550 for full-time staff, which is defined as over 35 hours a week. $800 for part-time, which is defined as 15 hours to 34 hours a week, and $400 for those individuals who work less than 15 hours a week, up to those amounts. Do I have a motion on that recommendation?
Motion to approve the committee recommendation that Chair Wilsfred just laid out.
Thank you, Derek. Do I have a second?
A second.
Was that Amanda? Thank you,
Yes.
Amanda, for a second. Jessica, could you call the roll?
Yes. Okay. Chair Oldfry.
Yes.
Great. Vice Chair Ohanian.
Yes.
Thank you. Amanda Ngola.
Yes.
Great. Kathy Hayes.
Yes.
Yes.
Fantastic. Great. So much. Okay.
And one last thing, does the committee want to use any of the other criteria that we offered as consideration? The percent of time working in person or on site, and the 60,000 or any other cap.
Thank you, Sarah. So do we need separate motions on those, or do we just need discussion?
I think that they could be discussed and voted on together if you wanted to apply any of them. I just think, I just want to make sure that we know what you want us to do. Otherwise, the cap would be obviously the ARPA cap, the 90,000, whatever it is.
Perfect. So why don't we start discussion on the income cap? And is anybody have, we can start with the motion of just approving it, but I just want to make sure we have, if anybody has discussion or an alternative, that we just have time for that debate before we move to the vote. And any alternative suggestions or questions around the $60,000 cap, income cap, annual cap?
Sorry, Chair. Oh.
I'm sorry, I didn't hear that.
I didn't
Derek.
either, but I thought I've had connectivity issues all night, so I thought it was me. Derek, I've passed my connectivity. Yes, I passed them to you.
No, I think Amanda had her hand for me, actually.
Amanda.
No, it was okay. I was deferring to you, Derek, but I just, I guess I'm not opposed to the salary cap, but mostly it sounded like, Jessica, you were saying that most people made under 40 anyways. Like, how many people are we kind of talking about that would go over 60?
I'm sorry, I don't have those exact numbers. I do have a sense that certain job codes did make more. And there are also positions that are not necessarily listed in gateways, like your finance directors or development staff, that could go over 60. But for the most part, assistant teachers and teachers would not go over 60. And a lot of the more front-facing positions would not.
Okay, so doing a 60,000 cap would capture more of these teachers as opposed to like the office staff or something like that getting bonuses. Am I understanding that right?
It would be more likely to get the office staff who might do some direct facing stuff, but relatively speaking little, because most of the time those the administrative staff is more likely to be, and executive directors at some of the larger centers are likely to be the only ones that go above that for the most part.
Okay. Yeah, I mean, I like targeting it toward those direct facing people, and the ones who are really working with the children and that kind of thing. So if that means having a cap, I'm in favor of that.
Yeah, I don't disagree with. Oh, sorry, Chair.
I was going to just ask you if Amanda covered your comments or if you had additional items. So I was going to you anyway.
It was, I basically have the same question as Amanda. I don't think I understand still. And I think it's probably a long week. I'm just feeling slow, but so the 390 number that Jessica had up of staff, was that under the assumption of the 90K ARPA cap of who would fall into that, or was that under the 60K?
That was under the 90K.
Okay, so then if we were to lower it to 60K, then we would drop off more people just by default. So then we would have more money to allocate between folks.
Yeah, it wouldn't be a lot, but there would be some. Yeah.
Okay, because I'm just thinking if we are going to do the 60, then we probably want to see if we can play with these numbers a little bit and make them higher then, and still follow the same staggered half as you drop down.
Right.
Number. Yeah.
I was thinking that if, we could do something like, say, we'd step up X ones by dollars to reach, if we sort of have a formula of how you would like us to look at that, so we can kind of get to the point, once we get the final numbers of people, we can adjust based on, a formula or a process that the committee is comfortable with.
Yeah, I think at least my recommendation would be is start with your top number for full-time being whatever it is, 1,600, 1,500. And then as you drop in tiers, just cut it in half and probably round, just so it's not like a weird 714 or something like that, just a rounded number to the nearest $50. And then as long as when you multiply all that, as long as it's under that 500,000, I think
Well, that's helpful. Yeah, if that would work, we would, if we were to, whatever we increase the top one, then we would make the same proportionate, and then we can do the math. That would be a very useful way of giving us direction on how to do it.
It's my way, and at least, I mean, it's basically straight, like balancing it out equally.
Right.
Yeah.
Right. I agree, Derek. And I will say, though, as we think through that, and especially with the lower income cap, my thought, and I might be pivoting us, so I apologize if the committee has more discussion on the income cap, pull us back and I can save this comment for later. But I do think that if the income cap gets us at essentially the direct services and sort of those folks that are more frontline facing. I think adding that next layer of that, the 35% direct service, it might become more complicated. And how are we calculating that? And how would, for example, the custodian fit into that category? I mean, they're clearly critical for the facility to function, but is 35% of their time serving children or families? And I could see one facility saying yes and one facility potentially saying no. And I think adding a second tier with the idea of the formula of adjusting the dollar amount, we could be getting quite complicated. And so I wanted to sort of see if folks thought the income cap, if that got us to the idea of that direct service, those people who needed it most, do we want to create another layer where there could be some reporting challenges?
I just personally, just from Jessica's and my standpoint, we're not recommending all of them. But if we do a cap is what we were saying. And I will be frank, the percent of time spent is so fluid among a lot of the positions just because of what happens day to day in a center. And it's also, it's not like they keep timesheets like lawyers. So it becomes it's a much softer measure. So if we by putting a cap on the overall income, I think is a much better way of focusing, frankly, than, and actually the ARPA definition of eligibility is also people who, for this front line is people who were in contact with stuff that other people had been in contact. So that would get custodians in that. But I think it's just really hard to try to pin down what percent. But we were trying to look at the factors that were discussed in the past. So.
And thank you, Sarah, for clarifying that. And I'm glad that you added that layer of it changes from day to day, it changes from week to week. 1 week, an administrator might just be, on the phone or in the front office. The next week, they might be teaching the whole week. And how do you calculate that? I could see just it being very difficult. So thank you for adding that layer. Yeah. I apologize. I still can't see. I'm back on my phone because I don't know what's going on. My Wi-Fi, but that means I can't see if people are raising their hands. So if you want to just unmute yourself and say something, or if Sarah or Jessica wants to let me know if I'm missing anybody.
So where we're at now is taking the wider net of the $90,000 suggestion, 90,000 plus income suggestion, to focus in on those workers to receive a increase, especially.
We are looking at the limit, and Sarah or Jessica, jump in if I get this wrong, but the ARPA limit for these dollars is $90,000. And in previous discussions, we had, as a committee, said that 90,000 might be too high. And so we're now discussing potentially lowering that 90,000 to 60,000 annual income. However, we've not taken a vote on it and still active discussions. So if you have a different suggestion, but the 90,000 is the limit per ARPA. And this is just a discussion of, do we lower that more? And part of the purpose of lowering it below the 90,000 would be to ensure that we're capturing the those direct line, those frontline direct service providers. And then what we would do with the remaining dollars is Derek's suggestion of increasing the amount in an equitable fashion that aligned with the same formula that we had for what we just approved, which is the $1,550 for full-time, $800 for part-time, and $400 for less than 15 hours.
So those are our two choices. We have to pick one.
No, you don't. We don't. If you thought that perhaps 75,000 would be the
no.
limit.
I'm not trying to get another choice in there. Wait, hold on. I'm not trying to get yet but another choice in there. I just want to be clear about the choices we have in front of us right now.
So we are discussing, those are the two choices, the 90 or the 60 as currently structured. But if somebody else were to want option C, we could discuss that. Was that
Option
helpful,
C
Kathy?
going once, option C going twice. There is no option C.
If I could say from raising that salary cap between 60 or 65 or wouldn't really have that much impact if it has any impact on who receives awards. I just included that chart so that the committee had a sense if we were looking at the salary cap based on housing cost burden families in Evanston, or what it would mean to, given Evanston's high cost housing market, what a salary would look like and what someone would spend on housing. We also know that the majority of, or nationally, many childcare providers who are teachers or assistants are often women and perhaps single head of households. So when we're looking at, excuse me, rents in Evanston, candidly, I thought that the HUD guidelines were a little bit punitive. So Sarah and I talked and raised it up to 60. If the committee feels like that is also, if there's an appetite to raise it a little bit more, we could go up to 65. And again, it would not have that much of an impact, I believe, on who is awarded and who is not. The component that would have an impact on who's funded and who's not is the percent of time spent in direct contact or on site. So if the committee did not want to include that as a consideration, we would be funding potentially more staff. But if the committee did include that 35% or more time spent working in direct contact, that could rule out some staff members and lead to higher awards. I just wanted to clarify. I don't know if that clarified, but I hope it did.
Oh,
So, go ahead.
Sorry, Chair. So I think taking a step back just to, well, what's before us? What's before our committee? So we've got the 90,000 cap, where when I ran it in my own Excel, the optimum was 1550 full-time, 800, 400, right? So that's the option. And the other option then is some constraints that we add to that population, being 60, 65,000 salary cap, and potentially this other dimension of, are they spending more than 35% of their time on site, which means that they're getting more exposure to potential hazards like COVID or something like that. So are we trying to say right now, or trying to make a decision on, let's go with the second one, which is the 60,000, 35% on site, and then whatever Jessica and Sarah and staff come up with, we already approve kind of antecedently, and we just trust that they go with that and they maximize the awards? Or are we saying, let them do the work and then come back to us? Because I think I'm lost. I don't understand.
I think, although great question, Derek, because I also have some questions now. I do think we were trying to go with, my intent was the idea of, let's decide on the 60,000, let's decide on the onsite or the 35%, and then let them do their work and maximize the awards. Because I do think timing wise, also like having them come back again after we sort of narrow it all down. I mean, if we give them the direction as a committee, I think these are families that could use these dollars, and I don't want it to necessarily get tied up in just triple checking. However, that's just me as the chair, sort of my understanding of what we were discussing.
I would agree with that, Chair. I would say second path, let's pick our constraints. Is it 60,000, 65,000 plus a 35% on-site requirement, and let them maximize based on the formula of start with a high number and then cut by half as you go down the tiers.
We did discuss that the 35% is a much less easy to confirm thing, though. So I think that, you know, I'm not sure that it would really wind up being very equitable just because of the nature of the fluidity of what people do sometimes. So we were trying to look at that as something that the committee had discussed, but it is, I think, very challenging for us to do with any what I would consider real certainty that it's accurate, and it does make a much more complicated formula.
Yeah, it does, yeah.
It would potentially eliminate people who, you know, again, kind of depending on, you know, like if we say to people, well, over the period of time, what was your percentage of time? It really is I think a very difficult thing to, so.
Yeah.
Right, that's what was confusing to me as well. I mean, that means the janitor, the lunch maid, the or whoever else, the part-time, I don't know, travel person would not get the incentive or the award, I should say, if we did it restricting face time, 35 hours worth of face time. Right.
It was percent of time was what it was.
Percent of time, I'm sorry.
Yeah.
I'm
A third
sorry.
of their time. Yeah.
That is not what I meant to imply. The restriction
I'm sorry.
was 35% of time spent in direct contact with children or families or on site.
Okay.
So on-site workers are
Included.
considered, you know, do have COVID exposure.
Okay. Okay, I'm sorry.
I apologize if I'm muddying the waters. Yeah.
No, I think, and so what Sarah's saying is figuring that out accurately and fairly is a pretty tough task. So that I recommend then we, just Chair's point about expediency, we eliminate that dimension, that constraint, and we just focus on a lower salary cap, 60,000 or whatever was, Jessica, that you had on your screen of housing cost burden, and redo the math and maximize the awards.
Yeah.
That's what I recommend.
I agree. I want to pause though and make sure Amanda or Archa or others, other feedback, I want to make sure we have the opportunity if you guys have comments about this component.
So one comment, I know we've got it, and maybe Derek, you could do it real quick. We have the 15 hours and less, and then we have 16 to 34 or 30. Sorry, I forget
34,
the hours.
yeah,
34. Could we break that? Like have 4 sections instead of just 3? Because I'm thinking somebody who's working 30 would only get half of the 34 hours. So is it possible? I'm just curious to see if we do like 15 and less, we do maybe 15 and 24 to 24 to 30, maybe something along those lines. Because I just feel like there's such a huge break for somebody working 30 hours, but would get $800 where like 34, just 4 more hours, and you're getting double that amount. I'm just curious. If it's too much work, forget that then.
Jessica, I think maybe you could describe why you just developed those categories, because you did kind of look at where people were falling. There were not that many outliers in certain areas, I think. Is that correct?
Correct.
Okay.
It's based on the way our application is set up.
Okay.
So agencies filling out or directors or whoever was filling out the application for providers categorize their staff as full-time given the 35 plus, part-time given the
less than, yeah,
right,
Less than.
15 to 34, and after conversations with providers, we did include that third category of less than 15 hours. So to to
Break
try
that
to
middle.
assess the staff working 15 to 24 or 24 to 30. I'm
We
That'd
have
be
to ask them to
again.
get us new
Okay,
information.
that's fine.
Yeah.
That's fine. No worries.
Yeah. Really, there aren't that many in some of those in between levels, I don't believe, because of the structure of their hours, you know, so.
Thank you. And our great question, Archana, and wonderful, helpful answers, Sarah and Jessica. Other comments from the committee before I try to summarize the motion? All right, I need a motion to limit the income eligibility for these payments to $60,000 annually, and for the staff to work to maximize the awards in a formula that is equitable and gets us as close to the $500,000 as possible, where the full-time gets a certain amount, the part-time gets half of that amount, and then the less than 15-hour a week staff gets half of the part-time staff amount. I need somebody to make that motion. I hope I got it.
You did, Chair, and I motion what Chair just said. To approve.
Thank you, Derek. I need a second.
I second.
Thank you, Amanda and Jessica.
Amen.
Please take the roll.
Great, thank you so much. Chair Spry?
Yes.
Great. Vice Chair Ohanian?
Yes.
Thank you. Kathy Hayes?
Yes, I can't wait to read this note.
Thank you. Archana Sood?
Yes.
Thank you. And Amanda Ngola?
Yes.
Excellent. Thanks. Thanks, everyone.
Wonderful.
We don't make your life easy as committee members, do we? Thank you for all your work on this.
No, I'm just grateful I don't have to type the minutes. All right. And with that, I think our next item, Jessica, is nomination for chair and vice chair. Is that correct?
Yes. So this could go a couple of different ways. I apologize. Let me grab my notes. So the current officers can agree to serve for another term. People can volunteer and people can also nominate. Those, if there are nominations, those who are nominated can choose to accept or decline. And then the new slate will be approved at the next, or voted in at the next Social Services Committee meeting. So.
Perfect. So right now, this evening, we're just talking about nominations. And the next meeting, we're voting on them.
Correct.
Wonderful. Do you want to start with chair or vice chair, Jessica?
I know it's at the
discretion of the chair.
Discretion of the chair.
At discretion of the chair. All right. Well, I am happy to continue to serve. I'm happy to pass off making very difficult motions and trying to remember everything that we've recalled and spoken about. So
I think you've done a fantastic job, Samantha, and I would be happy if you continued.
Me too. I'm a newbie. Can we keep it just the same? I'm just saying.
Yeah. Yeah, Derek too. He's done a great
Derek
job.
too.
Well.
I'm gonna need you in there with that Excel sheet.
All right, I need and Derek and his Excel sheets and brilliant ideas. Absolutely.
Okay. Sounds like we have our slate.
Yeah, I'm happy to. If nobody else wants to try out vice chair, I'm happy to continue on for another year.
I don't know if you noticed, Derek, no one gave you the opportunity to say anything other than yes.
I was
Yeah,
trying to
that's
work
true.
it in
Yeah,
there
that's
quick.
true.
I was trying to work it in quick in case it slipped out
No, no,
and
you
somebody
got me,
got
Kathy.
volunteered.
Yeah.
Perfect. All right. Well, thank you. And with that, I believe, did we have an additional public comment period? We just had one in this meeting. Is that correct?
We do have 2 public comment periods. We did receive written comment. I don't know, Anna, if you wanted to read that out, or if we could include it, Sarah, in the packet for review.
I think if we could just mention who, I don't want things read in, but normally what we do is just summarize who sent in anything and just so that it does get in the public record in that way. Why don't we just do that?
Okay. Then the written public comment. I'm sorry, so I provide the name of the person.
The name of the submission and as the person submitting, and then what they were submitting about.
Okay, perfect. So the written public comment we received was from Alejandra Ibanez. And this public comment is in support of the Welcome Center. So great.
So we can write that up and include it with the packet that goes to City Council.
Yes, perfect. And then if I could share my screen one final time for staff report. I apologize. I'll try to make this quick, but we really do have a lot going on. Okay, so at the October meeting, we were going to review mental health applications, but I heard from providers that they needed more time. So the mental health applications, the support services applications will close on the 17th of next month. We also have our case management and safety net applications, which will open at the beginning of next month and close toward the end of next month. So staff is suggesting canceling the October meeting. I do have up that, so we will nominate the chair and vice chair at our November meeting. We'll
vote on them.
Right, I'm sorry. We'll review the mental health applications that came in, and staff will also present the community needs from not only our youth and young adult outreach workers and our victim advocates who are city staff, but also from Family Focus, Connections, Moran Center, Infant Welfare, and all of the partners we fund for robust holistic case management and others who may have counseling or mental health referrals. Staff suggests a truncated application process for case management and safety net services for applicants who were awarded in this year. But any new applicants or any new programs will fill out full applications that staff can also summarize and have for the committee's review. And then staff recommends, because that's going to be kind of a full meeting, that agency representatives from case management and safety net be on hand to answer questions that the committee may have, but not necessarily make their full reports or their full
presentations. Yeah,
their full presentations. Yes.
What Jessica's really worked out, I think, is beneficial to both the committee and to the applicants, because our applicants that this would be their, we've been under our new process for, in theory, 2 years, but in reality, more like a year and a half. But we have some experience, and those applicants, to put them through a full application when we're asking the same types of services seems, kind of to be a bit onerous. We, of course, do want to open up to see if there are any new providers that are interested in providing either safety net services or case management. and we would have them do the full application. But as you probably all recall, there's a lot just about the organization in those applications, and we're trying to reduce the burden on our applicants to fill out the same information that hasn't really changed from prior years. By also not having everybody make full presentations as we've all historically done, when that I think was much more important was when everybody was coming in with their own programs and they were saying what they, it made it really quite different. So again, we're trying to streamline the process wherever possible for efficiencies, but without taking away from information that we think is important to the committee is what we're trying to do here.
Thank you, Sarah and Jessica, for outlining that. I did have a question, and I don't know if it would help streamline it or if it would be helpful, but do we have yet reporting from the case management and safety net current providers or current awardees from, I think, some of those efforts and some discussion on those outcomes could be helpful in streamlining that discussion
right
for in November and then in December.
Right. And historically we put that information in along with a summary of their, what they've put in of the information. We've always provided, this is what's been happening in the last year, so that you're right, that is very important.
Yeah, so I can say that staff did provide sort of a halfway report summaries in August. And I would be happy to forward that information on. Agencies don't report again until mid-October. But I would be happy to provide summaries again of their third quarter numbers at the November meeting, and then their final reports are due in January of 2023. So we wouldn't have final reports, but we do have the first 6 months of progress, and I can certainly provide summaries for their third quarter and their progress, like to date. A cumulative report is what I'm trying to say. For the
Thank you, Jessica. It was the updated data. I couldn't recall if we had them reporting monthly or quarterly, and so basically, prior to the November meeting, we wouldn't have anything new to share.
Not new information, but you would be for the allocation meeting, because we're not talking about allocating case management and safety net until we may end up, the allocation is probably going to end up being it may very well end up being in January, just based on the realities. I'm afraid our meetings may run long. And that would be perfectly fine to push that into January if the committee would like to do it then, so that they have the that third quarter information. So it would be 3 full quarters for the year. We wouldn't have the fourth one necessarily, because that we wouldn't get until middle of January, and we don't want to push that far. But if we were to do the discussion and allocation at the January meeting, which we sometimes end up pushing back a week depending on how the month falls, because otherwise it can be really crazy, but that would be quite early, but we would have the information. Then I believe we could get the recommendation to council by the 2nd January meeting or the 1st February meeting at the very latest, which is still getting everything going quite early in the year.
Perfect, thank you. I think at this point, this structure makes sense. I think as we get the applications, we see the data, we can discuss as a committee and decide if we feel we have everything we need for allocations in December, or if we need more information, and hopefully the November meeting will be enlightening and
right,
we'll be ready. And if not, and we have more questions, we can revisit.
Right.
Perfect. Okay, my final slide is just the wrap up, so I'm going to stop sharing. Whew.
I think that's everything we need.
And yeah,
Thank you all very much for a long but very productive meeting, I think.
Yes. And with that, I believe we have a motion to adjourn, and a hearty thank you to the wonderful staff for all the work that you guys have done to pull this all together, and to the members for sticking with us, and the members of the public who've stayed with us as well. Thank you and have a wonderful day.
thanks everyone.
Bye, everybody. Thank you.
Bye-bye, everybody.
Bye.
Good night.
Night.
Thanks, Jessica, once
Thank
again.
you, Kathy. Yeah. Have a good night.
You too, dear.